So the first thing to understand, Trish, is that this Bill C-47 is just one of about 7 steps that Health Canada has outlined in what they call the self-care framework. So when we talk about this bill, it's only one part of a wider framework, and there's other parts that are falling into place right now, and it's collectively that's going to create the problem. So this Bill C-47, which is just our budget bill, but they snuck in changes to the Food and Drug Act, it's going to impose on the natural health industry. It's going to give Health Canada broad powers, but more importantly, it's increasing the fine structure to such an extent that we're in tyranny zone. So we're going from $5,000 a day or an offense to $5 million per day of any violation, and not just the company, but any officers, employees, and directors, managers, etc., are all personally liable for the similar fines. And I can tell you, I've had files where Health Canada's caused deaths, and where clients resisting Health Canada has saved lives. So you can't assume that some bureaucrat with no health training can make good health decisions when they say, oh, you have to remove a product from the market. Now, we're always going to have vitamins, because for political reasons, you can't take vitamins away. They're too ingrained in our culture. But what you can do is you can make sure that the amounts in the vitamins, if somebody follows the label, are at levels that are non-therapeutic. And the problem with this whole self-care framework is these fines are just one part. Another part is they're bringing in cost recovery. So they're going to impose the chemical drug fees upon the industry. And then what they're doing is they're saying, well, we're going to create a new enforcement arm, because we want to regulate the natural products the same as the chemical drugs. So we're increasing the regulatory burden, and we want inspectors there on the ground to make sure that you're complying. But more importantly, they want inspectors to be going out into the marketplace and seeing if people are sharing truthful health information that they're not allowed to share. And so, for example, Health Canada is saying, well, when we get to the end of this self-care framework, you're going to lose the right to use traditional use evidence to support efficacy claims. Well, a large part of the natural health product industry is based on traditional evidence, and some of the traditional traditions, like the traditional Chinese practitioners or the herbalists, I mean, that traditional use evidence goes back, thousands of years. So these products have been safely used for thousands of years for specific conditions because they work for those conditions. But they want us to basically run clinical trials now to do this. And there's no intellectual property rights. So those clinical trials aren't going to be done, and the products will disappear. But they also don't want these products to be used for any conditions for which you'd seek the advice of a healthcare practitioner. So they want to limit us to basically over-the-counter use, which is why they're calling them self-care. So they're saying, look, once we come out with these new regulations and you're regulated the exact same way as chemical drugs, this is not for conditions for which you would seek medical advice. Well, then you have to go through the new drug approval process, and there's never been a natural health product in history that's gone through that process, because it costs about $1 billion. You have to have you have to have a patent with a good shelf life on it to go through the process. You just wouldn't spend the money, and you wouldn't be able to raise the money. So everyone like me in the industry understands that we're basically moving to where we're going to lose most of our products and just be in a chemical drug model at the end, and that's the goal. And the Ministry of Health knew that there's no way Canadians wanted these powers and penalties imposed on natural health products. So that was defeated in 2008. Like, the government backed down and didn't reintroduce the bill. In 2014, these exact same powers and penalties were imposed on the chemical drug industry through what's called Vanessa's Law. And nobody really cared. We don't care if Pfizer faces a $5 million a day fine, for example. But knowing that no one wanted these imposed on natural health companies, Health Canada snuck it into the budget bill. So the one issue in my lifetime that has enraged Canadians more than any other issue, Health Canada and the Ministry of Health deliberately snuck into the budget bill. So there's a company called True Hope that has a product called eEmpower Plus, which I can tell you, in my opinion, from having to defend them in court against Health Canada and call world-class psychiatrists like Dr. Charles Popper who's a psychiatrist at Harvard Medical School that just teaches doctors to become psychiatrists, and who set up for their two regulatory boards that will certify child and adolescent psychiatrists. He set up their standards, and he's also the founding editor of the Journal of Child and Adolescent Psychopharmacology. I mean, he basically said on the stand, and he's just one example, like, if I got bipolar disorder, this is what I would use. And it just he explained to the court it destroyed his practice, because basically half his patients tried it, and if it works, and it works for 8 out of 10 people with bipolar disorder, you just get well. Like, he doesn't even have to manage them, right?
Yeah.
Literally, he said, because he gets the worst of the worst, that he would meet with every patient every week to, manage their side effects, and to counsel them not to commit suicide that week. And then after half his patients were in EMPR Plus, he'd meet with them not weekly, every 3 to 6 months, and basically have coffee. So this company, there's 35 published peer review research articles. Listen, Trish, all funded by governments across the world. So this is government money, governments researching a product, and, published in blue chip journals like the Journal of Psychiatry. Like, we're talking high level research. The government of Alberta stumped up over $500,000 for a double blind clinical trial. Like, this is a product governments have gotten behind. And prior to these penalties being imposed, True Hope had links to those 35 studies on their website, because even though Health Canada takes the position, without there being any legislative authority, they take the position you can't let people know stuff like that's out there. All you can say is the approved label claim, which is something like supports mental health and well-being. Well, now that there's $5 million a day fines, True Hope has taken that down. Well, I mean, I've been on this topic since 1994, and ironically, I got into it acting as counsel for Health Canada against a herbalist. So, I mean, I was on the other side at first.
Yeah,
and,
interesting.
And on the inside, there's basically hatred towards the natural health product industry. But I mean, I think it's regulatory capture, and I also think it's just simple human nature. I mean, most of Health Canada's budget comes from the pharmaceutical companies in the form of fees, and just subconsciously you don't bite the hand that feeds you. The whole premise that natural health products are so dangerous that we need ever stricter regulation is, actually just a false argument. And they never actually do a deep dive. Well, what's the risk of taking natural products away? Because every time you increase a regulatory burden in any field, you reduce the access to products. I mean, it's just cause and effect. You increase the cost to companies, and you have fewer products and fewer competition, right? We didn't have any regulation of natural health products till July 1st of 2004. That's when our natural health product regulations came in. So prior to that, it was the Wild West. Now, I just wrote a discussion paper on this what's happening right now, and it can be found at www.nhppa.org. Now, I pulled for that discussion paper, and I included as the last page a table from a risk analysis that Professor Ron Law did in 2004. So this is when we have no regulations. And so he's using Canadian government statistics largely. He's also using statistics from other Western nations to have a wider pull. Yeah. But so using government statistics in 2004, so largely Canadian government statistics in 2004, when they're totally unregulated, like everything in a health food store is unregulated. Did you know that in 2000, and just the point I'm trying to make is if stricter regulations make us safer, well, we have way stricter regulations right now than we had in 2004. We had no regulations. So we're way stricter. So using 2004 figures, when it's the Wild West, you were 14 times more likely to be struck by lightning, Trish, than you were to be harmed by natural health products. Wow. You're 428 times more likely to die bicycling than to die from natural health products. You are 714 times more likely to die in a school bus accident than to, be killed by a natural health product. You're 1,071 times more likely to be murdered in Canada than to die from a natural health product. Not a single one of us would give any freedom up to be protected by lightning, and yet you're 14 times more likely to be struck by lightning. 14 times is such a significant difference, it's not even fair to use lightning strikes as a comparison. People are already mad, and we're going to roll this back. But we have to do it together. We need your help. We need you to be writing letters. We need you to be calling your MPs. We need you to be meeting, and we'll need you to take other actions. But together we're going to do this because we have the right to decide how we're going to treat ourselves when we're sick, and we're not going to give that up.